Imagine facing a nearly doubled health insurance bill overnight. That's the stark reality looming for many Californians enrolled in Obamacare, with premiums potentially skyrocketing by a staggering 97% in 2026, according to the Los Angeles Times. But here's the crucial question: how did we get here, and what does it mean for the average Californian? The source of this impending crisis is a budgetary standoff in Washington, D.C. that threatens the very foundation of affordable healthcare for millions. When open enrollment begins on November 1st and continues until January 31st, Californians who renew or try to sign up for public health plans through Covered California, the state's Obamacare exchange, may experience significant sticker shock. These federally subsidized plans, designed to make healthcare accessible, face a dramatic price surge if enhanced tax credits, implemented during the Biden administration to expand eligibility and lower costs, are not extended. These credits are currently enjoyed by approximately 1.7 million of the 1.9 million Californians enrolled through Covered California. The heart of the issue lies in a political tug-of-war. The Republican majority and Democrats are locked in a debate over whether to continue these expanded tax credits. These credits have been instrumental in extending healthcare access to a broader range of income levels. For instance, a family who previously couldn't afford insurance might now be covered thanks to these subsidies. But here's where it gets controversial. Some argue that these tax credits are unsustainable and contribute to the national debt, while others champion them as essential for public health and economic security. This open enrollment period is usually a time for comparing plans and making informed decisions. However, the government shutdown introduces a cloud of uncertainty. These subsidies, initially introduced as a response to the COVID-19 pandemic, have kept insurance costs down, but they are scheduled to expire at the end of the year unless Congress acts. And this is the part most people miss: even if the subsidies were extended, premiums were already projected to rise by about 10% in 2026 due to rising drug prices and the increasing costs of medical services, according to Covered California Executive Director Jessica Altman. As Altman points out, Californians navigating the Covered California website, https://www.coveredca.com, face difficult choices. The potential loss of tax credits only exacerbates what can already be a complicated and stressful process. Without these subsidies, Covered California estimates that members receiving financial assistance will see their monthly premiums increase by an average of $125 in 2026. Californians are going to be facing a double whammy: premiums going up and tax credits going away, Altman warns. The organization fears that these increased costs will force many to forego health insurance altogether. We estimate that as many as 400,000 of our current enrollees will disenroll and effectively be priced out of the health insurance that they have today. That is a devastating outcome. Indeed, this premium spike threatens to undermine the very purpose of the 2010 Affordable Care Act, Obamacare, which aimed to provide affordable healthcare to Americans who earn too much from Medicaid but cannot afford private insurance or do not receive employer-sponsored coverage. This includes a wide range of Californians, from bartenders and hairdressers to small business owners, farmers, freelancers, and those juggling multiple part-time jobs. It also disproportionately affects those with chronic conditions who require frequent and costly medical care. The Biden-era subsidies at the center of the budget dispute have extended coverage to an estimated 160,000 additional middle-income Californians by raising the tax credit eligibility threshold. These subsidies save members approximately $2.5 billion annually in out-of-pocket premium expenses, according to Covered California. To mitigate the impact, California lawmakers have allocated an additional $190 million in state-level tax credits in the next year's budget for individuals earning up to 150% of the federal poverty level. This would maintain 2025 premium levels for individuals earning up to $23,475 per year or families of four earning up to $48,225 per year, and provide some relief for those earning slightly more. This state support is helpful but may not be enough. Forecasts from the Urban Institute project a similar drop of approximately 400,000 enrolled members in Covered California. The national picture is even more concerning. The Congressional Budget Office, CBO, warned Congress nearly a year ago that allowing the enhanced premium subsidies to expire would increase the number of uninsured Americans by 2.2 million in 2026 alone, and by an average of 3.8 million each year from 2026 to 2034. Organizations providing affordable Obamacare plans are bracing for a wave of Californians being squeezed out of the system. LA Care, the county's largest publicly operated health plan, offers covered California policies for 230,000 mostly lower-income individuals. Martha Santana Chin, LA Care's CEO, notes that approximately 90% of their covered California consumers receive subsidies. Unless something drastic happens, a lot of those people are going to fall off of their coverage, Santana Chin said. Such an outcome would have far-reaching consequences. As more people become uninsured, more will rely on emergency rooms for non-emergency care, straining the healthcare system. This, in turn, will likely lead healthcare providers to raise prices for insured patients to offset the costs of treating the uninsured, ultimately impacting even those with private insurance. Currently, with subsidies set to expire and recent changes to Medicaid eligibility potentially removing some of the lowest-income Californians from that system, Altman and Santana Chin are primarily concerned about those with no alternatives. They are particularly worried about people of color, who are disproportionately represented among low-income Californians. Even a small increase in insurance costs could be devastating for families already struggling to make ends meet. $100, $150, $200, that's meaningful to people living on fixed incomes, Altman said. Where is that money coming from when you're living paycheck to paycheck? This situation raises critical questions. Should healthcare be considered a right or a privilege? What role should the government play in ensuring affordable access to healthcare? And what are the potential long-term consequences of allowing millions of Americans to go without health insurance? Share your thoughts and concerns in the comments below. Do you agree with those who say the subsidies are unsustainable, or do you believe they are a vital lifeline for vulnerable populations? Let's discuss.